Hi, I am Dr. Elo, one of the elite ICE 50 avatars to present this course on Complete Guide to the Dental Peer Review Process by Gina Gallagher, October 20th, 2023. Section #3. What happens if you're part of a peer review committee case? The peer review process typically begins when a patient or third party contacts their local dental society with a complaint. The dental society staff screens the complaint to determine whether it's appropriate for peer review. If so, the patient must submit a written summary of the issue. The committee notifies both parties of the complaint, asks the patient to sign a release allowing access to their records, and requests that the dentist submit treatment records for review. There are two phases to the process: mediation and committee review. Phase 1. Mediation. The mediation phase is used in nearly every state and does not involve the peer review board. In this phase, the board chair appoints a mediator, either a fellow board member or a volunteer dentist, who works with both parties to try to resolve the dispute. According to the ADA, in most cases, mediation results in an agreement, after which the peer review board notifies both parties formally. If it involves money, the agreement letter notes those details and includes a release form that indicates all claims have been satisfied. If no agreement can be made, the case goes on to the next phase, along with the notes from the mediator. Phase 2. Peer Review Board. The peer review phase is a lot like an arbitration, where each party presents its side, and the board assesses the facts, and usually, reviews the mediator's notes, evaluates clinical treatment records, interviews the dentist and the patient, clinically examines the patient. Each committee member does so separately. Each board member then submits a report of their findings of the patient exam to the chair, and the board meets in closed session to evaluate and discuss the case. The board's report is an internal document that's not shared with either party. When a peer review decision is rendered, the ADA outlines what should happen after the committee comes to a decision. The outcome is based on a majority vote or consensus. The board notifies the dentist and the patient in writing of the decision and recommendations. Boards do not share individual members' recommendations, only the committee's findings. The entire process, including mediation, typically takes 90 days. The board sends all case documentation to the Dental Society. State law dictates how long the Dental Society retains records. Both parties must abide by the board's decisions and sign release forms that reflect their agreement. If a party does not agree, they may appeal to the Dental Society, usually within 30 days, if they can show cause. Issues that may support a successful appeal include failure to follow proper procedures, additional materials becoming available, and evidence of bias or discrimination. Dental societies generally do not have the authority to enforce compliance with a board's decision. However, either party may seek to enforce their signed agreement in a court of law, since non-compliance with that agreement may be considered a breach of contract. If payments are required, the dentist, dental society, or malpractice carrier may need to report them to the National Practitioner Databank. How can you prepare for a peer review committee? If you find yourself involved in a peer review, preparation is key. Here are 5 useful tips to help you. 1. Do your homework. Familiarize yourself with the peer review process as well as the guidelines and requirements of the Dental Society and the peer review board process. There are a range of resources that can help you understand the process.